Welcome. In one of my recent videos, we discussed the misinformation around COVID deaths in the UK. That misinformation was driven by using a subset of deaths rather than all the deaths. Now, one of the best ways of understanding COVID deaths is to use something called excess mortality. And if we use excess mortality, as we'll see, COVID deaths around the world are in fact much greater, not much less, than the official statistics. The number here is actually quite grim. Around the world, the pandemic's true death toll, this is from a paper in Nature, is much, much higher than the official counts from countries around the world. So what is the true cost of COVID in terms of human lives? One of the best ways to estimate the cost in lives of something like a pandemic is this idea of excess deaths. They get used in other circumstances too. Some of the most common ways excess deaths are used are to, well, something like this: understand the mortality cost of past wars and epidemics. If you see estimates of the cost of the 1918-1919 pandemic flu, the so-called Spanish flu, those estimates, the best estimates of that staggering cost, are from excess deaths. Another use of excess death estimates is to estimate the impact of policy decisions like non-pharmaceutical interventions, lockdowns, vaccinations, masks, and so on. This is harder to do because you have to make appropriate comparisons, and it's easy to misuse when you start making inappropriate comparisons. And a third use of death statistics is forecasting, and that is to prepare people for future challenges. If we see an epidemic or a pandemic coming, we can prepare for those future challenges and have some idea of the expected number of deaths, or at least that range of deaths. So how is it done? It's actually reasonably simple in principle, but fairly complicated in practice. The basic idea is to take data that we really should have, and that data is the actuarial death data. So typically nations will track this. A national statistics board or something will track that per nation. And in the use of excess death estimates, what one does is tabulate that data in fixed time windows. So there might be weeks or months, and we would expect some seasonal variability. So if you look at the excess deaths over a calendar year, that may not be the most appropriate window to look at excess deaths for, say, an epidemic, because most, say, infectious disease epidemics that happen in the northern hemisphere happen in the winter months. So an epidemic year might run from the end of one summer to the beginning of the next summer, or the end, something along those lines. So we would expect some seasonal variability in those weekly death reports. But we can use that. So once we have the data, we can build a model. And the model is designed to fit the available data and then to predict upcoming expected deaths. So there are various different types of models for this. There are regression models, basically statistical models. There are time series models. This is another class of statistics models. And then there are machine learning models, which are also statistics models, but borrow some ideas from computer science and artificial intelligence. So this is kind of three broad classes of the types of models that get used. The minimum that is needed to estimate excess deaths is some accurate death records so that the number of expected deaths can be predicted. And then the excess deaths are the observed deaths minus the expected deaths. But not all countries provide accurate death records. So in the absence of accurate death records, we might be able to use other types of data. So there might be other actuarial data on, say, comorbidities and so on that can be used to estimate the death counts and then from then estimate the excess deaths. While there is a world mortality data set that's the basis for understanding global mortality and excess mortality, many countries don't participate in it. This is partly because many countries don't have the resources to handle those kinds of actuarial statistics very well, or it's also because some countries just choose not to participate in it. This is a map from a paper by Karlinski and Kobach, which is a paper on estimating excess deaths during COVID. And all of the countries shaded in this blue, green, whatever color this is, are countries that do participate. And those countries that don't are there in gray. And as you can see, lots of countries don't participate, including many highly populous countries like China, India, Bangladesh, Pakistan, and so on, as well as many countries, also very populous countries in Africa. So this poses a problem for understanding world mortality. So if we have to do something different for those countries, but for those countries that do report all-cause mortality, what are the types of methods that get used? Well, there are many. As I mentioned, 3 kind of classes, and I'll mention 4 methods that are used to track COVID excess deaths. The first of those is a paper published last year in PLOS One that provides a set of estimates and actually provides a tool that people can use to look at those estimates from world mortality data set. This is from the short-term mortality fluctuation data, a subset of the world mortality data. One of the most widely used models, and it was a model in the first graph that I presented in this presentation, is a model from The Economist. The Economist magazine has generated a model that tries to look at the whole world, not just countries in the world mortality data set. For those countries that are in the world mortality data set, they use a common method, which is a machine learning method called gradient boosted decision trees, that they use bootstrapping to estimate the variability. Where countries don't provide all-cause mortality data, so they don't provide those kinds of death tables, they use a set of estimates based on covariates. So for those countries that do provide, they also have these other covariates, comorbidities, and so on, age distributions, and they use those to build a kind of a proxy model that they then apply to those countries that don't report all-cause mortality. And those data, of course, those predictions are not going to be as tight as the ones where the data is reported directly. The third model is the model that is used by OurWorldInData. So if you use that OurWorldInData website, you'll see some excess mortality estimates, and those from a paper by Karlinski and Kobach. And that data is a regression model from weekly expected deaths. And I put the formula here because it's a fairly simple formula. This is the expected deaths in a given week, in a given year. And that's just a linear model with some coefficients per year. And it's each week. So each week is basically modeled on the weeks prior and this common factor for the year. So that's a fairly simple model. And it allows prediction of excess deaths for 2020 and 2021 as deviations from extrapolation of that model from data prior to 2020. So the data that's used is up through 2019, and then it extrapolates into 2020 and 2021, and now 2022. And then the other most widely used model is the IHME model, and this is an ensemble of 6 predictive models that is used where all-cause mortality data is available, such as those in the world mortality data set, and then it uses a bunch of machine learning methods, so feature selection and predictive model development for those countries that don't have all-cause mortality data. It basically starts by building a model where it is available and then predicts into countries where it's not available. So in that sense, it's similar to the Economist model, but it is it uses a different statistical framework. So this is the model from The Economist drawn on a world map. In this case, what we're seeing here is a picture of the official deaths per 100,000. The darker red a country is, the higher the death rate per 100,000. So in this case, we can see countries like Peru have high death rates. Other countries, Bulgaria has a high death rate. But these are all officially reported data. From The Economist, they also calculate excess expected deaths, and there we see something quite dramatically different. We see many countries that are much darker, have a much higher level of estimated excess deaths per 100,000 people. And those countries range from, say, Russia, Bulgaria, Kazakhstan. Actually, Bulgaria also had high deaths earlier. India, Bangladesh, Brazil, and Argentina, and Mexico. So many countries have, and a bunch of countries in Central America. Many of these countries, by this model, are underreporting COVID deaths quite dramatically. We can also look at the OurWorldInData data. So this is a map of excess mortality from OurWorldInData. Here, they don't try to estimate those countries that are not part of the world mortality data set. But we can see countries like Russia, like Brazil, have quite high rates of excess mortality, even though Russia reported in its own official tally a much lower rate of COVID deaths. One of the most dramatic findings from this, both from the Economist model and from the Karlinski and Kobach model that's used in OurWorldInData, is that some countries are clearly undercounting the number of COVID deaths. In those countries that do a very good job, where the number of COVID deaths seems to be well counted, the number of COVID deaths and the number of excess deaths track quite closely. So it does appear that the number of excess deaths in most countries, that the vast majority of those are due to COVID-19. But for countries like Tajikistan, they report an official COVID death toll that is 1/100th of the excess deaths. For countries like Russia, maybe 1/5 the number of excess deaths, but of course it's a big country, so many people, and correspondingly a lot of death. These are the top countries from the Karlinski and Kobach model, top in terms of undercounting. These are the countries that most dramatically undercounted COVID deaths when compared to excess deaths. So that provides some examples of countries that seem to be underreporting COVID deaths, even though they're tracking deaths accurately. What about countries that don't have accurate death tables in the first place? As we've seen, those include many less developed nations, less economically developed nations, and it also includes nations with large rural populations where even if the nation itself is relatively developed, like India, they have large rural populations that may not all report deaths accurately. So let's take a look at India. Well, the first thing is that it's known that death tabulation varies really widely across the state. The civil registry does tabulate deaths, but it hasn't tabulated deaths in all states for a very long time, so it's not a very mature process in many areas. In many of the rural areas where many people in India live, many deaths are just never tabulated, and instead the remains are cremated. So those seem like real problems, potential weaknesses, but there is one potential resource, and that is that almost all households in India have a cellular phone. And a paper that was just recently published used this fact and some other data to try to estimate the national COVID mortality in India. So this paper by Jha et al. Is very interesting. They looked at disparities in India's COVID death toll. And in those disparities, what were they looking at? Well, they used 3 different sources of data to try to get an estimate of excess deaths. Because not every state tracks deaths at the same level, they used a private but government-authorized agency that takes daily surveys, the C Voter Tracker Survey. They take daily surveys of thousands and thousands of people in India, and they have done so for a while by phone. So that company started adding COVID tracker data early in the pandemic on a nonprofit basis. So in that survey, they picked 2,100 randomly selected households or respondents weekly. They distributed them all over India's geography where people live, so 98% of India's populated geography. They did interviews in 11 languages. India has many spoken languages, and they were prepared for all of the major language groups. And they asked, has anybody in your household died of COVID? And so this allowed them to get a survey response of people dying of COVID, regardless of whether they had been tracked in the National Civil Registry. The second data source was kind of a government source, but it was not that kind of survey data. It was sampling data of all-cause mortality at facilities, so places like funeral homes, undertakers, in rural areas. So spread across India, they could do this sampling of all-cause mortality, even in areas where they weren't entering data regularly into the National Civil Registry. And then finally, they used the all-cause mortality in those 10 states that had a lengthy history and had a mature process of tracking deaths in the civil registration system. So from that, what did they learn? They learned quite a lot. One is that the number of reported deaths from the survey data far exceeded the officially reported deaths attributed to COVID. And when they added in the additional facility data, they found also additional discrepancies and were able to get a revised estimate of total COVID mortality in India. And not surprising, this revised estimate is much, much greater than the official toll from the COVID pandemic. In fact, the revised estimate is 3.2 million. So the 95% confidence interval on that is between 3.1 and 3.4 million, and they estimate roughly 3.2 million excess deaths from March 2020 through July 2021. But as of January 2022, the official COVID-19 deaths in India is just under 500,000. So there's a 6-fold difference in the estimates done using these sampling methods and survey methods in addition to the official data than there is from the official data. I think these cases, the cases of either underreported COVID deaths or difficulties tracking deaths in general, both lead to some pretty stark conclusions about how we should be thinking about COVID mortality around the globe at this stage. So first, when countries track deaths well, so they have good death tracking systems, they have good registries, and if they also track COVID deaths reasonably well, so they have high testing levels and so on, then the reported COVID deaths track pretty closely to excess deaths. So if we track excess deaths, that's actually a good measure of COVID mortality, at least in areas that aren't, say, currently experiencing war or other, major traumatic sources of death. In addition, some countries apparently undercount COVID deaths, even if they're counting deaths in general well. So they may be using too narrow a criteria for COVID deaths. They may be doing it intentionally or not intentionally. None of that matters. It's still an undercount. And using excess deaths, you can sometimes identify the issue. And in some cases, it's really large, like Tajikistan, Nicaragua. In other cases, it's still fairly large as a fold difference, 5-fold, 6-fold difference for Russia. But Russia has such a large population, that's a lot of undercounted death. The third is that even for countries that don't have accurate death tables, where you have to use some other estimate, either a proxy by virtue of, say, comorbidities and some statistical modeling, or a sampling-based method like what Jha et al. Used in India. In all of those cases, it appears to be consistently the case that those countries undercount COVID deaths, often very dramatically. And those are large population centers in the world. The combination makes a broader conclusion inescapable, and that is that COVID deaths in less developed nations, many nations around the world, are almost surely undercounted by a fairly large multiple. If we combine that with the population in those countries, the relatively smaller population in the countries that are tracking deaths and deaths from COVID quite precisely, the global mortality is much greater than the daily reports would have us believe. And so what's the solution to this? Well, the solution has to be better equity of vaccines, better equity of treatments, new treatments that are coming available, new vaccines that are coming available, in order to address this dramatic inequity in infrastructure, in service, in vaccine availability that is contributing to this massive wave of death in many countries. That's where I'm going to leave it. If you've found this valuable, give it a like or a subscribe. Let me know in the comments if there's something that I didn't address or that you'd like to see addressed in a future video. And in the meantime, stay safe.